is James Prick, and myself and Dr. Elizabeth Carlton at the Colorado School of Public Health are the co-directors of the Colorado Consortium for Climate Change and Health. And I'll very briefly describe what that is before we jump into our main event for the day. So the Colorado Consortium for Climate Change and Health is a network of researchers around the state at different research-focused institutions, universities, hospitals, other research centers, who all have a passion and interest in climate change and health issues. And it exists really to bring us together so that we are not sort of siloed and kind of working off on our own, but we have opportunities to meet each other socially and collaborate, and for mentoring for more junior scientists and researchers. And I think it's a really special organization. Back pre-COVID, we had some in-person events for the whole consortium once or twice a year, as well as more focused events for sort of affinity interest areas at other times as well. During COVID, we pivoted to doing mostly remote events, but we hope that next academic year we can do a better combination of in-person and remote events. So today's event is going to be ably assisted by Elise Grover, who is handling the logistics in the background. She is a DRPH student at the Colorado School of Public Health in Environmental and Occupational Health. Beth Carlton, do you have anything you want to add before we get started?
Just want to say thanks to all for being here today. I think this is the third of 3 panels, and we've had really nice participation. We've asked the panelists to each give a brief 5 to 10 minute talk, and then we'll have time for question and answer. So I encourage you to submit your questions that you may have through the chat, and look forward to the conversation.
Yeah, I'm really looking forward to this conversation. I think that we've done these twice before, as Beth said, and the discussion at the end has always been a great deal of fun. So today's topic is going to be climate and health policy, and we have 4 amazing guests here to talk about their own experiences with that. All of them come from like have very different approaches to engaging with climate and health policy. So I'll just introduce them in turn as they come up to speak. The first speaker today, I'm just going to go in order of what we have on the flyer. The first one is going to be Bhargavi Chekuri. Dr. Bhargavi Chekuri is a practicing family physician based in Washington, D.C., and a National Climate and Health Science Policy Fellow at the University of Colorado School of Medicine, a partner of Climate for Health. She completed her residency training at the New Hampshire Dartmouth Family Medicine Residency Program. So Bar, take it away.
Hi, yeah. And I actually just moved to Denver, so I now practice here in Denver. I work at Denver Health, but I was working in DC. Yeah, thank you so much for having me. It's really nice to be here. I think a lot of you may know about the fellowship, so I'm one of the 5 fellows this year, and it's been a great year to really sort of delve into this climate and health space that you really don't get a lot of exposure to. Well, I didn't in medical school or in residency. So as part of the fellowship, largely what we sort of have a major federal agency placement, and then we also work with a smaller either nonprofit or academic institution. And so I work with the US Global Change Research Program, and I've been working as a fellow as well as a technical contributor for the human health chapter mainly, which Mary Hayden is leading. And I also work a little bit with the air quality team. I think in terms of the first couple of months of working with them, a lot of what I was doing was just kind of understanding the agency, how all the interagency kind of components work together, trying to get a sense of, how funding streams were being allocated at the federal level, that sort of thing. And as I sort of, over the first 6 months or so, I think that the work that I primarily do there is really provide my expertise as a community physician that sees and touches patients, and as someone who's sort of an end user of the document, which is the National Climate Assessment. So a lot of, the expertise, I'd like to think that I provide is sort of the expertise of being the end user and being able to translate some of what these amazing scientists and researchers want to say, and sort of provide some context to how to maybe communicate that in a way that's often presented in terms of like a story or something that I actually see on a daily basis. The other work that I do and sort of have been areas of interest, like research interest that I've really been working on, is I also work with the Payne Institute of Public Policy at the School of Mines. And so doing a little bit of research into looking at the health impacts of mining for critical minerals and metals, as well as also they're doing a lot of really interesting work on sort of supply chain transparency. And we've recently been talking to them about how to think about applying some of their work in that sphere to maybe health sector emissions, and to see if we can get some more transparency just in our own industry. That's probably a much longer project and will take several years probably to really have be fully fleshed out, but it's a really interesting idea. And a lot of, I think, the work that I do with Payne and School of Mines is really trying to bridge two very different disciplines, which is mine is, at the end of the day, family medicine. And then the other big thing that I really have been working on this year is academics. So thinking about, I helped co-direct the medical school elective at the University of Colorado School of Medicine. I'm in the process of creating a residency elective and thinking about how to sort of expand into graduate medical education. I think the electives are sort of these deep dives for really interested students, but the other sort of area that I'm really interested in is I'm going to be staying on as faculty next year at the University of Colorado, and really thinking about, so how do we go beyond these electives to really thinking about integrating some of this education at a department level, and think about maybe like how to integrate this content into existing funded learning streams. So things like within population health, health equity and advocacy, within global health and refugee health, even thinking about how do we integrate climate change and health education into like pediatrics, women's health, LGBTQI health, that sort of thing. So that's sort of mainly what I've been working on. So a little bit of federal stuff, and then a lot of academic kind of, I think of it as sort of policy too, in terms of academics, because we're trying to change this machine that's academic medicine and what their curriculum sort of is currently sort of hinged on, and really trying to add a new lens to it. So I'll stop there.
Well, thank you so much, Bar, and I'm thrilled that you're going to be staying on as faculty at the University of Colorado. That's a real treat for us in this state. Next, we'll hear from Dr. Katie Dickinson. Dr. Dickinson's interdisciplinary research focuses on the impacts of policies and interventions on environmental, social, and health outcomes. Much of her current work involves community-engaged environmental justice research in Colorado, exploring issues that include public housing and oil and gas development. Over the past couple of years, Dr. Dickinson has worked with policymakers and advocacy groups to inform climate and environmental justice policies, including HB 21-1226, the Colorado Environmental Justice Act, which was signed into law in 2021. Take it away, Katie.
No problem. And are you seeing my correct screen here? Presenter view? Okay, great. Wonderful. Well, yeah, I'm really excited to talk with you all today. And what I'm going to focus on is some work, some engagement I've been doing with policy for climate justice. So I'll talk a little bit about what climate justice is, why it's important, how these different policies are hoping to achieve or advance climate justice, and who's involved. Let's see here. Okay, so very briefly, climate justice and environmental justice are very closely intertwined. The basic idea behind both of these concepts is that everyone has the right to live in an environment that is healthy, that is safe, and to have equal access to enforcement of environmental laws and regulations. Looking specifically at climate justice, there's this recognition that the impacts of climate change are not going to be distributed evenly across society. And so policies to address climate impact, whether that's mitigation policies or adaptation policies, resilience policies, really need to take into account those underlying systems of inequality, oppression, and work to counteract those. So to work for just climate policy. So why is this important? Well, of course, we know that the impacts of climate change are not currently being felt equally across members of society. This is just one example of a report, kind of in aggregate, estimating losses, economic damage to counties across the United States as a result of climate change. And again, this shouldn't be shocking to anyone, but seeing that the largest losses are anticipated in areas that tend to have, where we have large proportions of people of color, where there's already, high environmental burdens. And so, this idea that climate change is going to exacerbate these divisions between haves and have-nots is again one of the sort of motivating facts that underlies this theory of, or this movement of climate justice. And I think when we think about, I think it's important when we talk about these impacts. I think we have examples that come very easily to mind, right? So Hurricane Katrina, I think the textbook example of how climate disasters are directly, they're not just natural disasters, right? These are man-made crises that both in the climate, whatever climate contribution to environmental stressor, but also in the way that plays out across society. So systematic underinvestment in levees in the Ninth Ward, for example, right? So, and then in the response and all of these cascading ways that systemic racism and other systems of oppression put certain communities, particularly low income and communities of color, at higher risk. When we talk about this, though, I really think it's important when we talk about climate justice to recognize that this is not just a story about saving low-income communities from climate change. We need to understand that none of us are immune from this. And I am giving this talk from Louisville, Colorado, where we just experienced the most devastating wildfire in Colorado history. And so I think, even an affluent community like mine is certainly not immune from this. And I think what's really important is to try and flip this narrative of us and them on its head. So even as we're talking about climate justice and the fact that some communities are going to be made worse or are going to be hit harder, that doesn't mean that some of us are just going to be fine. And so it's really a matter of saving those communities. I really loved this book by Heather McGhee. Many of us have read this as part of book club and other different venues. But this idea that if we keep saying we can just push the burdens onto some communities, that the rest of us, the affluent, the privileged, will be fine, that's a false narrative. And really what we need to be talking about when we're talking about climate justice is the ways in which investing in the health and safety and well-being and climate resilience of all communities will benefit all of us. And so this idea that solidarity and bringing folks together is really important. So how are we going to get there? There's action at the federal level that we've seen. So on basically, day one executive order from the Biden administration focused on tackling the climate crisis at home and abroad. And a key portion of this is what was called the Justice 40 initiative, which says that 40% of the benefits of certain relevant federal investments need to go to disadvantaged communities. And that's, there are tools that are being developed to facilitate the implementation of the Justice 40 initiative. This is a beta version of an economic justice screening tool that's, kind of making attempts to identify which are disadvantaged communities so that we can track where investments are going, for example. And again, just noting that this is a beta version, I welcome people to look into this a little bit more. We can get into it in the Q&A maybe. There's lots of questions about how to do this, and particularly this federal tool is race blind for reasons that we can talk about more, but it's definitely tricky and complicated question of how to target these investments. Colorado is also taking the lead on climate justice in a lot of different ways. So back in 2019, we passed the Climate Action Plan to Reduce Pollution, which generated this climate greenhouse gas pollution reduction roadmap. And as a follow-up to that, in a lot of ways, last year I had the opportunity to join with a coalition of folks that wrote and ultimately were able to pass the Environmental Justice Act, is sort of the short name for this bill, and it really built on a lot of the ideas of the Climate Action Plan, but tried to insert a greater emphasis on environmental justice statewide, sort of across all agencies. So there are many different things that this bill does. It defines disproportionately impacted communities in a sort of provisional way. There's an action task force that is working on refining that definition, as well as developing a more comprehensive set of recommendations for how to advance environmental justice across agencies. That task force is a temporary task force with a set timeline. It also creates a permanent EJ advisory board and an EJ ombudsperson. It is creating a grant program that will allow funds from penalties, from environmental violations to be invested in disproportionately impacted communities. And it does a lot on this climate front to provide more teeth to a lot of the provisions that were in that earlier environmental justice climate action roadmap. So there's a lot that's happening here in Colorado, and I was at a national environmental justice conference recently where I said I was from Colorado, and somebody said, "Oh, we've heard about the things that Colorado is doing." So there definitely is a lot of leadership on this front. And when I talk about leadership, what I think is really important when I talk about policy, when I teach policy to my students, I want to make it really clear that policy is about people, right? Policy doesn't happen without engaged people being a part of that. And so this has been the best part of getting involved in this work for me. It's been meeting and being inspired by the many local climate justice leaders that are working in advocacy organizations and local government and federal government. So there's just a handful of folks that are, here in Colorado in the community that I've really had a chance to learn from and be inspired by. And I just want to kind of end us here by saying, as we're talking about, us here in this climate consortium, as climate and public health scientists and professionals, I'm kind of challenging all of us to think about what our role is in that, in the work that we're doing. I know that many of us, feel a little conflicted about engaging in policy work and advocacy as scientists, but I also, really feel strongly that, Desmond Tutu had it right here. So this idea that we can just be neutral and do our science and kind of assume that the policy work will follow from that, I think is there's some challenges in that. So there are a wide range of different roles. Doesn't mean we all have to quit our jobs and become full-time advocates, but thinking about how we engage in this policy space individually and collectively as this consortium is something I'd like to talk more about.
Great, thank you so much, Katie. That's great, and hopefully you've given people some food for thought. I do want to remind those of you in the audience that you are welcome to submit questions for our speakers in the chat. We'll also have, a full discussion at the end, but we'd love to have your questions now if you are inspired to ask them. And the next speaker is going to be someone else who also has managed to sort of squeeze some policymaking into their day job, Dr. Anthony Gerber. Dr. Gerber is a pulmonologist at National Jewish Health, where he's a colleague of mine. Dr. Gerber is in the Division of Pulmonary Critical Care and Sleep Medicine, and he's chairman of the Colorado Air Quality Control Commission. Take it away, Tony.
Thank you. And I do have a few slides that hopefully I can pull up here. All right. Can everyone see those? So I just want to talk a little bit about, I think, really the interface of wildfire pollution, which is a long-term consequence of our failure to act on the climate and health, and sort of use that as an example of some of the really basic research challenges we face. I'm not going to talk a lot about the policy. I do think that my experience on the Air Quality Control Commission shows how complex that can be. I don't speak for the whole commission. However, when you go about the process of regulating greenhouse gas emissions, it's important for people to do that on a state level. And that gets back to what the previous speaker said, if we don't do it, who can? But it's also true that if you, for example, cast regulations that, really eliminate the oil and gas or drastically limit the oil and gas industry in Colorado, the person who's replacing that on the market might well be a dirtier producer, or in the setting of the war in Ukraine with Russia, it might be Russia. So it's a very complicated landscape when you start doing the regulations to try and change this climate problem. And that sort of frames the talk, is that I think we also need some practical research into what is coming down the pipe for us. And so I think that, and wildfires were mentioned in one of the other talks, they are a massive problem. These are just some, shots from media showing it even gets into Boston. This was a fire in the Colorado area a few years ago. One of the things I wanted to highlight is that, if you're standing here near this fire, that might have a different effect than this kind of smog you might see in Denver. And what's burning and causing that wildfire pollution can be very, very different. So some fires encroach on urban areas and burn cars and plastics. Common sense says you'd much less rather breathe in the incinerated products of a car than maybe the incinerated products of a tree. But we don't really have ways to distinguish that on a public health level. It's well known that wildfire smoke is a really bad actor. So this is an estimated slide from a few years ago showing an estimation of 340,000 person years global mortality per year. This is only getting worse. Unfortunately, there's really well-established predictive models that the length and frequency of wildfires with a 1.5 degree increase in global temperature are going to be significant. If we're lucky enough to limit it to 1.5, unfortunately, much of the West Coast is among the hardest hit areas in the world. If it's 2 degrees, it's going to be even worse in this terms of frequency and length. So many more days with this kind of air quality. There's ample evidence that air quality from wildfires is a bad actor. So lots of epidemiological studies that I don't do, but I can read, suggests that wildfire pollution is not a unique kind of particulate matter pollution. And of course, we regulate PM 2.5, which is particulate matter 2.5 at the source, and there's fairly stringent regulations around that. However, we can't regulate wildfires. We can indirectly regulate them by trying to reduce greenhouse gases, but that process is going to take years. So we're faced as an air quality community with a problem that we can't regulate. And I will note a little bit later, even though it's pretty widespread, you can't really say that an area near a historic source of pollution like Suncor, that area is really disproportionately impacted from wildfires. Some of the mitigation measures that more affluent folks can take are not available to some of those disproportionately impacted communities. This is just an example from data in Australia. The big blue line here is when there's a lot of wildfire smoke. This was done a few years ago. So again, there's just lots of evidence that when you have those wildfires, that people are going to, seeking out medical care. Now, this is an interesting paper that sort of suggests, it's a review in the New England Journal, that talks about what you can do to mitigate the effects of wildfire pollution. And again, we're having 1 to 2 months a year in much of the West Coast when the air quality has these wildfire particulates. So you can move, if you're rich and don't have, and can work remotely, maybe you just fly to another place. That's a little unrealistic for most of us. These engineering controls have built into them some DI disproportionate issues because the tightness of the house and the ability to afford a HEPA filter are directly related in many ways to your socioeconomic status. This stay indoors and avoid heavier prolonged physical activity, I think, is a problematic recommendation. It's one thing if it's a fire that's going to be gone in a day or two, but when we have 8 weeks of fire, to tell people to stay indoors is really unreasonable, and it has an effect on their health as well. If you need to exercise for other health reasons and now you have to stay indoors, that's a major problem. I think we can sort of discard the idea that people are going to wear N95s based on masking during the pandemic. And again, this would have to be a fitted, expensive, and uncomfortable mask, and really is, I think, not practical except in the worst situations where if the fire is really, right near you. So what's the practical implication here? I think it's a huge challenge, and we need to kind of start to wrap our mind around this as a community. So this is just an example of the kind of warnings we get from the Department of Public Health. I don't know what you do with a warning like this. Do you drive up to Wyoming? The whole area has a terrible air quality forecast. And, it's telling a huge number of people to not go outside. It's a problem because, in fact, the air quality is never bad everywhere, and those warnings come out and they're flagged for kind of the worst area. I'm proud to say I work at National Jewish Health, and for whatever reason, we tend to have among the worst air in Denver based on monitoring. But you can see there might be a day when the air is bad right here, but it's actually pretty good in a lot of other areas of Denver, and yet that warning might go out and it lacks the granularity. And then what do they tell? Again, the warnings are, kind of go inside, avoid the smoke. They're not particularly useful. And this creates a problem for people with lung disease. So if you have COPD, exercise is one of the few things that can make these people with COPD live longer and do better. I encourage my patients to exercise with COPD. It's one of the primary recommendations I give. And yet, the wildfires in the West can create air quality that is bad for weeks. What do we tell this patient? If the patient isn't affluent enough to drive somewhere else, can't access a gym, do they just lose that conditioning that they fought so hard to gain, and do they stay inside? This is a big problem for children. If you have intermittent asthma and you're the parent of any of these children, are you worried about exercising in August with bad air quality? Should she skip soccer practice? What if it goes on for 4 weeks? And could that exposure cause her asthma to permanently get worse and become chronic as opposed to intermittent? And there's reason to believe it might. Data from a number of years ago looking at particulate matter, this is all particulate matter in the Los Angeles region, showed that children who grew up in these areas with higher levels of chronic particulates were less likely to achieve normal lung function as adults. But if you look at the percentages here, even in the worst areas, it's 8 or 10% of the kids aren't getting their normal lung function. The rest of the kids do just fine. The problem is we don't know who those kids are. We don't know which of the adults who are going to have the bad potential long-term effects. And yet the recommendations we give are one size fits all. So we really need to do a better job with the regional delivery of messages. Is your particular area got the really bad air quality, and who within that area might have the worst problem? And that gets a little bit into the kind of research I do, which is totally disconnected from the advocacy work through the Air Quality Commission. But people put a lot of effort into researching genetics to try and understand who might be predisposed to get a specific disease. The problem is that the genome is enormous. And when you're trying to do this for lung disease, you also need to integrate pollution-based exposures because not everyone is exposed. So it becomes a very complicated problem. And so one of the things that my lab has been trying to do is to try and limit from the 3 billion base pairs we have to look at to just a few 100,000 base pairs that are really regulating the response in the lung to pollutants. And in so doing, we've been able to, I'm not going to describe sort of the fancy genetics, but we've been able to identify some variants which are quite common that actually might change that inflammatory response. And if you have this particular variant, which actually responds in the lung to pollution or wood smoke, that can be either protective or deleterious in your risk of getting disease and associating with the particulates. A lot more research is needed on this. But I guess what I wanted to leave you with is that we are going to need, unfortunately, because I think a lot of the wildfire pollution is baked in. Even if we cut greenhouse gas emissions 100% tomorrow, we're still in a situation of wildfires. We need more research, so we're not giving a warning to everyone. We're giving warnings to people based really on where they live and on their genetics, and potentially recommending specific medications which might mitigate the effect. So that's all I have to say, and hopefully we'll have this will stimulate some discussion as we move forward.
Hey, thank you so much, Tony. I appreciate that.
Hey, Jim, are you wanting to take questions as we go along? Did I hear you say that?
Yeah, could you type questions in the chat, and after the next speaker, we'll start with questions.
Okay, great. Thank you.
So you can type it in the chat or just hold off, and you can speak up then. Yeah, so thank you so much, Tony. Yeah, I know that the places to our west are facing an even deeper drought than they've had sometimes in the past couple of years. So it looks like smoke is here to stay, at least this year, probably more years going forward. The last speaker today is going to be Colin Toome. Colin is a climate and health strategist at Boulder County Office of Sustainability, Climate Action, and Resilience. In her work, she reaches across county lines to address the common sources of air pollution and greenhouse gases through state-level programs and policy, working closely with public health and the policy office. She brings health, science, and equity expertise to the policy process through government and professional collaborations. Colin has a background in bioscience, green building, business sustainability, and air quality. She holds a BA in biology from Harvard University and a master's in architecture from the University of Utah. All right. Take it away, Colin.
I should unmute myself. That'll help. Thanks a lot. It looks like I can be heard now. So yeah, I have kind of a unique position. We have a pretty solid climate team here at Boulder County, but we recognized quite some time ago that we couldn't do what we needed to do to protect our residents strictly from within our borders. So I will throw up a few slides here, and hopefully I can do this correctly. How am I doing? Okay, got a thumbs up. Okay, so that was my cover page. That's who I am, what I do. So this is kind of the issue that we're dealing with here. That local governments really cannot protect their residents with the. Oops, am I still sharing? Sorry, I had a technical difficulty there.
We're seeing your first slide, Colin.
You're seeing my first slide? Okay, good. Are you still seeing my first slide?
Yes.
Okay, wonderful. Thank you. Sorry about that. The issue that we're having is most local governments have greenhouse gas goals. The intent of those greenhouse gas goals is to protect our residents from the effects of climate change. These are strongly supported by residents and as well as elected officials. The problem being that we can't control our greenhouse gases and even meet our own goals to protect residents without without having an impact beyond our borders, and this involves both programming and policy. Are you all
sorry to interrupt. We're seeing it in like, yeah, if you put it in presenter mode.
Yeah, sorry, I seem to be having a problem with that. Okay, so it is in autoplay.
I mean, it's fine if you want to put it the other way.
Okay, I will just talk through. Let me see. So I will just talk through the. I will unshare and then I will share back. Sorry. Am I unshared now?
Yeah, we're not sharing a screen.
Okay, wonderful. Thanks. So sorry about that. we work on both programs and policy. So the programmatic work that we work on tends to support policy, and it is everything from business sustainability to greenhouse gas reduction and air quality interventions, you know, things like replacing lawnmowers and non-road sources of greenhouse gases. And a lot of the times these are useful both as you're going towards policy, as you're helping to prepare folks to comply with mandatory policies, as well as to assist compliance once those policies are in place. And then we do work on policy, and it is one of those, you know, we work with local governments, we work beyond our borders with other local governments, with local public health agencies, with scientists, with equity experts, such as Dr. Dickinson, and equity experts who are engaging at the state level, environmental organizations, as well as community organizations. And this is really what is, we're seeing increasingly many local governments that are choosing to engage at a broader level outside their borders through positions such as mine. So I will quickly throw up this graphic that I hope actually works. If I can do that successfully. Are you all able to see a cartoonish slide?
Yes.
Okay. All right. Well, so this slide is just meant to illustrate this kind of circular relationship between the types of policy that we work out at the state level. So legislation is proposed. It goes through to rulemaking, to regulation in order to be implemented. And then regulation can very often inform what legislation is proposed in order to further the goals of those rules. These are undertaken by state agencies, boards, and commissions. And I think in the center of this graphic, I've put the stakeholder inputs, and that is from the public and is from experts. That is you all. And so this kind of relationship forms the center of the policy work that I work on in terms of engaging scientists, experts, regional bodies, such as the Metro Denver Partnership for Health. And this is really where you come in. I know that since we're talking policy here, I wanted to make it clear that there is a role for health expertise, and it needs to be much stronger than it is. I would say that we can do a much better job of getting health expertise in the policy comment process. And so, you know, I would say that, you know, most policy is supposed to be public, but it does tend to be anything but accessible. It's especially inaccessible for busy professionals and for people already burdened by inequity. And, you know, my job is really to help get those folks to the table, help them navigate the process. And I would say you probably glimpsed in that earlier slide something that's been on my mind lately, which is, you know, every time the wind blows, very much like probably this is happening to Katie as well. You know, I'm haunted by the Marshall Fire and you know, the two more that started just in the last 2 weeks. That's all of them a little more than a couple miles from our house. So, you know, when health is viewed to include not dying and losing everything in an urban firestorm, not to mention toxic combustion products, it really ties the physical and social determinants of health to climate in a whole new way. And, you know, I would encourage folks, as you are beginning to engage in policy and to engage with organizations that can help you to do that at the beginning of your careers, I would encourage you to make sure that you do relate to things that are local, immediate, and personal, and are very closely tied to health, because that can help get around some of the inevitable politics that are there, and also to make sure that everybody understands this can happen to anyone. So I know that in our questions, I'll be able to address a little bit more about how to get involved in policy, but I think I'll go ahead and leave it there.
Great, thank you so much, Colin. And you teed up the first question that we're going to ask all of you very nicely. I appreciate that. So the first question is going to be my question, and then we'll go on to the questions from folks in the audience that have been presented in the chat. So my question to all four of you is, for those people in the audience here today who are not yet heavily involved in policy in any way, but want to be, what are some good ways to get involved? What are some good on-ramps that maybe aren't quite so obvious, like, email your congressman kinds of stuff? What's kind of the next step beyond that?
Do you mind if I go ahead and just grab that? So one thing that we have heard from Congressfolk is you elected us, we're doing our job. Don't email us, but get involved in the public process where you can be heard, where everybody there isn't necessarily already on your side. And so that is what we've actually heard from our Congressfolk here in our district, in the Boulder County area. And I would say that when you're trying to get involved in policy, especially earlier in your career, you're trying to balance, helping to build the critical mass of health expertise and opinion, and then working your way towards a deeper engagement of your expertise. So that means, giving public comment at the legislature or Air Quality Control Commission, testifying at the legislature, starting to follow your own local government's sustainability policy efforts, to get familiar with what policies are out there, get used to the process. Advocacy organizations, I would say, such as Healthy Air and Water Colorado, can help you get familiar with the process, and you can start making 2 to 3 minute comments. It's really good practice, like streamlining what's important. And then as you gain expertise, for example, in legislation, you can be placed on expert panels that go first before the legislators are too tired to ask questions. But in any case, climate change is closely tied, as Dr. Gerber said, to air quality. Both are really visible here in Colorado. Your comment should be informed and on target with the policy being considered, but also really earnest and humanizing. So I really want to second Dr. Gerber's comment there that he began giving public comment before becoming a commissioner and now chair.
Tony?
One of the things I'd say is that sometimes there are kind of what I don't know if I'd call them consolidators of comment. They manufacture and will sort of bring in a bunch of people where it's obviously not heartfelt, it's staged. That tends to be less effective and daunting. You think that other people are covering this, but suffice it to say that people have been sitting on these commissions for a long time. They know the difference, and people who are really coming at a grassroots level and are interested, and it's an issue for them, that comment does resonate. There isn't infinite time to comment at these commissions, but it can help connect you with groups. You can see who is working with those. And it also goes the other way, reaching out into the community as a citizen who's interested can also be effective, because sometimes there's a lot of misinformation out there about different rules and regulations. And when that gets propagated, that can make the rulemaking job that much more difficult. I can't really comment on specifics, but I would say that for the employee trip reduction program, which was stopped, and I'm not going to comment anymore on that, it was clear that there'd been a lot of misinformation about that program. And the sense that if that misinformation had been combated in the 3 to 4 months leading up to it, that maybe that it wouldn't have met with the fate it did, was certainly expressed by members of the commission during the rulemaking. And again, that's my own personal, not professional opinion, but it makes a big difference. It really does.
I'll jump in here too. So yeah, I think that's been my experience, is that, I think one thing that is really important for folks to know, and again, when I teach my policy class, we take a field trip to the Capitol, and I show folks, like, you can walk up to the sergeant at arms, like walk up to the door of the House and hand them a little business card that says, Katie Dickinson, I'm from this district, I would like to speak with my congressperson. If they're not actively voting on something that minute, your representative will come out and you can have a chat with them, and you can say, I'm from the School of Public Health. I research wildfire and its health impacts, and I just wanted you to know that this is an issue I really care about. If you ever have, the need for expertise, please give me a call. It is that easy to access. Like, the barriers to getting involved at the state level are really low. You can, I was just going to drop in the chat here, if there is something that you care about. So if you go to this link and then type in, here, you know what, I'm actually just going to share my screen for a second. So if I go to this link and then I put in wildfire, and then I can say, I just want to look at what the current bills are. So in this session, there's a bill down here that I've been keeping an eye on that's hoping to increase outreach around wildfire mitigation. So then I can go down, it says it's under consideration. What committee is it in? It was referred to the Senate. It's going to be, look, there's a hearing on Wednesday for this bill. And then there are links here, so I can click here to listen in on it. I can sign up to testify. It's just, so I think, again, the process that I walk my students through is, I had students, I think I didn't manage to convince any of my students to testify in a bill last year, maybe one. But this year I have a few who took my class this year who are testifying in sessions this year. And I think it's just getting that familiarity, understanding that, like, these are just normal people, citizens showing up and being heard. So I think it's great to get involved in this process. As others have said, I guess what I like to tell people too is, right, like, we don't all have to do everything, right? We can't, but we can all do something. And even just being informed and voting on local initiatives that are coming up, right? Showing up at city council. There are many, many things you can do. And I think it's just a matter of and the other piece I'd say is that, policy, I said policy is about people, and it's also very much a team sport. So you don't have to do this alone, right? So figure out what advocacy organizations are also working on this bill and testifying on it, and ask them, like, what types of testimony do you think would be most effective? So yeah, doing this, finding your people, finding the people who are also working on that, the things that you care about, and just being able to show up as, like, I know some things about this. How can I present that knowledge to people who are making decisions in an effective way?
Well, that's great. Thank you all. Before we get to the audience questions, Bar, do you have anything to say about the NCA?
Yeah. So, I mean, the NCA is interesting because it's a assessment, and it's meant to be policy informative, not prescriptive. And so it's really like a scientific assessment. And that being said, I think thinking about how I've testified when I was in New Hampshire, I testified at state Senate hearings and stuff. I think the expertise that really, like, I bring to that particular project is my ability to be able to relate some of what they're trying to present in that assessment in terms of actual communities or families on the ground, and sort of give them a scenario or some storytelling. And so my advice, really, if people are interested in trying to, get more involved in policy or advocacy, is to really lean into that storytelling side of things. Like, the statistics are not what the person on the other end is really going to respond to. And so really kind of leaning into that. And yeah, Katie, totally agree. I think finding your friends is probably, like, particularly for me and medical students that I work with and residents, it's when we're teaching advocacy, it's like the crux of it is finding someone who can kind of flag that bill that's coming up and say, hey, there's this bill that's coming up. Are you interested in testifying? And they'll kind of talk you through how to do it if you want to. And then if you don't like public speaking, you can write, you can, there's all sorts of ways that you can get involved.
Great, thank you, Bar. It looks like colleen Reed had the first question.
It was just a small question. It was more just, I think it's more along the lines of, I think that sometimes I agree that there are limits to what we're saying in terms of what to do during wildfires, but I think that there are possibly creative policy solutions that should be thought about. rather than just thinking like there's nothing we can do from a public health perspective for various people. So I don't know. I was just sort of putting that out there as like, instead of saying like we can't tell this, like what are we going to do? These people need to be outside. Other things like that. But then I think Lee actually brought up a really good counter argument to mine, is that people who have to work outside, and what we can do about that, because there's less, there's like, that's something they are going to be doing for their livelihoods. And so talking about that.
I certainly didn't mean to imply that I wanted to say it is a problem. You can't just tell everyone to stay inside or have everyone exercise like there's no problem. And clearly, providing resources to make people's homes cleaner, transport potentially, to the gym. I mean, it's not everyone can even get to their gym. I do think that the outdoor worker is a significant problem. Let's be very clear. We've known for decades that certain coal mining activity causes irreversible, horrific lung disease, silicosis, and we still have almost a mini epidemic of it, despite the knowledge and exactly where it happens in the workplace. So, having a solution, again, I'm not being the naysayer, to people who are working outside where the risk is lower, is going to be more challenging. But I think the first thing is to shine a light on the problem, that this is a problem, it is getting worse, and our current solutions are inadequate. And then getting a suite of potential, ranging from medications, which might help, to personal protective equipment, to genetic testing eventually, to know if you're that person who is destined to really have a problem versus someone who might be more resilient, along with trying to address the people where it's a socioeconomic issue. They need the job, or they live in an area where there aren't, easy transportation corridors. So I think we need to pay attention to the problem. And I'm not being pessimistic about solutions. I'm being a little bit pessimistic that the problem isn't going to be here for the next 10 years. I think that is baked in, unfortunately. No bad pun intended.
Lee, do you have any comments?
Yeah, I'm having a really bad allergic reaction to what you're saying, Tony. So I'll let me hit my inhaler and then come back to you. One of the things I want to point out here is that we talk about these vulnerable groups as though we know what they're experiencing. And when it comes to workers, I'll give you another example. There's a new paper out, which actually I kind of like. It was a Delphi method published in GeoHealth, trying to get at what are like the 20 top things we could do to protect workers better, especially ag workers, from heat exposure. Now, it doesn't even cross over to talk about the combined effects of different contributors to climate change, like wildfires and heat. They just took heat. And you know what? They didn't have one worker or one person from the labor movement on their panel to even say, is this feasible? Is this something real that we could actually think will work for us? This convergence of environmental justice and climate change effects are playing out very clearly in our workers, who are the climate canaries. Okay, I'll get off my soapbox now.
It is a massive problem, and I think you bringing your knowledge of that particular sector, and we ignore it. I mean, there are fascinating interviews with coal miners who they see the problem, they've had relatives die, and they don't know how to get out of it. It's their livelihood. I mean, it's a really difficult, and you're right, interviewing the people who are most impacted is a key part of it, and you're right, we often ignore that.
Next comment looks like it's from Douglas Tarrant.
It wasn't really a comment. I was just sharing information from my previous talk I gave to the group, that the presentation I gave was published, and it's about, it does bring up issues about wildfires and the extreme weather conditions that occur now and its effect on food systems. So all these extreme events, do have a big factor on those who are most vulnerable, especially in low and middle income countries. So I was just sharing that information. That's all.
Thanks, Douglas. Looks like Allison had another comment along the lines of the wildfires in asthma.
Yeah, Tony, I guess my question is, it doesn't look like my video's working now. Maybe it is. There we go. Is that when you're talking about the numbers, you can put the percentages out there and you say really only up to 10% of asthmatic children that are exposed to air pollution during childhood have decreased lung function. Lung function isn't everything, first off, right? It is a good indicator, obviously, but it's not everything. And do we know, can we really say that though all of the other individuals that aren't having reduced lung function in adulthood aren't going to have other chronic lung diseases like lung cancer, for example? So,
absolutely not. That was not what I was trying to imply there. I think the evidence is unbelievably strong that there are genetic risk factors. I mean, you can see that with smoking. Some people can smoke 3 packs a day for 30 years and they have pretty normal lung function. Other people, it's a pack a day for 10 years and they come in, you're surprised how bad their lung function is. We know that a few percentage of people who never smoke get emphysema, and that is probably related to environmental exposures. It's never good for anyone. But again, in a situation where you have weeks on end of pollution, it's not a zero-sum game. So we know that obesity and sedentary activity is a problem. So what I was trying to say is that we know there's a genetic spectrum. Telling everyone to stay inside is probably not the answer. And so more research to try and understand the particularly high-risk individuals, knowing that we will never get there. It's an epidemiologically massively complex problem, but at least maybe finding the people who are at the highest risk could, that could be really, more life-changing for them and maybe prevent them from having really significant lung disease. Versus other people, it does become a trade-off. Do you want the cardiovascular health? If I'm not meaning to imply that everyone that only 10% are affected. I'm using that to say there's definitely genetic variation.
Yeah, it seems as though the recommendations we get from the different medical societies are not well aligned when it comes to wildfire smoke either. The pulmonologist recommendations versus the cardiologist recommendations versus the neurologist. They're all kind of different, and I feel like the medical societies need to huddle up and try to find some consistency, and there needs to be a lot more research to inform that kind of consistency as well. Looks like Rocky had some comments. Would you like to say them in person?
Hey, thanks so much. Yeah, and some of them are just comments to share. Welcome any thoughts. They focus primarily around the lack of guidance that Colorado provides to local jurisdictions with regard to land use and the interconnected issues that land use and development patterns have with transportation, air quality, climate, and social justice. So some of those are just comments and observations that I'm offering. But what kind of challenged this group, I get the message that the scientific community likes to work with data and information and can be a little shy on the policy front. But I think if we're really going to take these issues on, Colorado may need to revisit its paradigm of just kind of allowing local discretion with what jurisdictions do and don't do with climate, and provide some sort of integrated framework that is given to local jurisdictions to work with. I'll just stop with my comment there.
Can I respond to that really quickly? Yes. So in the aftermath of the Marshall Fire, I partnered up with a group of researchers to look at the recovery process and to look specifically at how local attitudes and policy preferences interact with decisions, that the local governments in the 3 affected jurisdictions, so Louisville, Superior, and Boulder County, are making. We knew this, we saw this, on day one, and it's already playing out that, conversations around building codes, right? Should people who lost their homes be required to build to, in Louisville's case, a recently passed a bill that was, or a policy that was passed in November. So just, a month before the fire occurred, that, updates to the highest, really the most stringent climate progressive building code in the state. And there's been a lot of pushback on that, and it's understandable. There's concerns about how that's going to influence building costs. But I think the larger point that you're really making, Rocky, is that we have we're asking this local community to decide how much we can, should, want to, will do to reduce climate emissions from the building sector for these 1,000 homes that are going to be rebuilt in the next few years. And the state, can provide a lot of incentives. There are a lot of, subsidy programs that are being discussed. Or there's really a lot of work that's going into trying to encourage this. But it's ultimately this local community that's just been hit by a disaster, our call, right? How much we do or don't do. And that's really tricky. And meanwhile, we have another ballot issue that we're voting on in the next week about how we're going to develop, a privately held plot. And there's a lot of, local conversation about how to do that in the most climate friendly way, and opposition to developing the space. That's been really well mobilized. I have not seen that same group of people mobilizing to say we need to get rid of single family zoning in Louisville, right? I'm not hearing that. So I think just, I don't have the answer, but I think you're absolutely right that the way that we are choosing who can decide for these land use decisions that have enormous collective global implications, it makes it really tricky.
Yeah, not to belabor this, but just to, again, I mean, the tragedy in South Boulder County is just sobering, but isn't isolated. I mean, within the last decade, we had 400 homes burned in El Paso County, in the Black Forest, which is a fire-prone area. We have the area outside Manitou Springs that lost around 400 homes. And there is that statistic that, we're in the top in terms of property losses due to fire, even though we're not a top state in terms of annual acres lost in fire. So I appreciate what you're talking about with building codes and so on, but would just offer, we may need a much deeper dive in terms of policy discussion at the local level.
I mean, I would add it's more than policy, it's really finances too, because for a lot of people, you can see when the price of gas goes up to $4, it's a big problem, and that it highlights the economic burden that has on people. It's also a big problem because you see how dependent we are on fossil fuel. People don't have ways to avoid that cost, and we have to be cognizant of that transitions and the way those costs are shared and the way people understand the indirect costs are the key to the whole problem. Like that's where the real injustice lies. The people who are going to pay for the change and the people who are bearing the current costs versus the people who are making the money, they are not aligned. And so it's really easy to put up a flag and say, we don't want this regulation because you feel like, depending where you are in that equation. That's where the problem is. And I think that getting the message out that we're all suffering the health consequences, we're all at risk for our homes burning. The wildfires are a huge problem, but they're also the huge opportunity because they're one of the most visible problem. The fires themselves destroy people's homes. They're horrible. People can see it happen to them. And when it's smoky for 2 months on end, people realize this is different than it was 20 years ago. So it's not that it's a challenge to solve this problem, but the opportunity that the media attention and the attention that is brought by these fires, I think that's an area we can grab onto and get the message out and try to help turn what is a tough problem to turn around.
All right. Well, thank you, Tony, and everyone else for this conversation. We're now past time, it looks like. So I'm happy to stay on a few more minutes if anyone is interested, but we'll also release our panelists to go back to their day if they would like. So please keep in touch. If you know anyone who would like to be on the consortium mailing list, I will put my email here in the chat, and you can reach out to me and I will add you to the list.
Thank you to the organizers. Thanks.
Thanks all. Appreciate it.
Absolutely. Thank you, everyone.